Hi, I'm James Jessup, the Sales and Marketing Director for PCS Thailand. Welcome back to our Facility Management Thought Leadership Series, where we gain insights from the movers and shakers within the FM industry, with a particular focus on data, technology and the workplace experience. Today, our spotlight is on combating COVID. As you all know, Thailand is currently in its third wave of COVID. This wave has been the worst by far. The number of infections continues to rise day by day, several thousand per day at the moment, and unfortunately the death rate is also rising. The vaccine program is starting to be rolled out now, and this provides some confidence that later in the year that things will get better. But having said that, there's still a lot to do. We need to provide confidence not only to employees but also visitors to the likes of shopping centres, schools, healthcare facilities and so on. So what really becomes important now is getting ready for the future, ready in terms of a cleaning, sanitising and disinfection regime. We hope that things will get better, but we do need the support of the broader FM community to make this work. So I'm very pleased to introduce our next guest on the program, Vikas Mittal. Thank you very much for joining us. Vikas from the Managing Director of Diversi. Perhaps you could start off by providing a little bit of information about what Diversi is and how it's supporting the COVID recovery.
Thank you, James, for having me here today and this opportunity to discuss such an important topic. Diversi is in the business of clean and hygiene for close to about 100 years now. Okay. And to be honest, we never realized our role being so important in times like today. COVID has literally changed things around us, and we have been in the business of saving lives, which is clean and hygiene basically. We keep hospitals safe, we keep hotels safe, we keep restaurants safe, and that keeping people safe has never mattered more than it matters today.
Yeah.
So that's our. So we are. That's the business we are in.
Yep. Okay. Great. And an organisation or business that's thinking, well, how can I actually? What are the basic things that I can do to make things better around, minimising the impact of COVID? Have you got any hot tips around that?
Yes. It differs from individual to an organization, and things are absolutely different. The way an individual would behave and should be behaving now or conducting their day-to-day lives, and an organization the way they conducted their business before and now. So for an individual, we could keep things simple. Social distancing, mask on, double mask, sanitize your hands. Very, very important, because a lot of people habitually not used to washing hands, disinfecting hands.
Yeah.
So that is very, very critical now, and wearing a mask is always it's inconvenience of sorts. On the other hand, for an organization, it's absolutely different. And we say organization, we are talking about industries, we are talking about offices, we are talking about hotels. Their biggest challenge is to get people back to those places. Yeah. Hotels need to get guests back in hotels. Offices need to get their employees back to work, to feel safe. So they need to reimagine the whole cleaning, or so-called cleaning, which they have been doing for so many years. That needs to change into infection prevention of this COVID. So that's how the world is changing. And infection prevention for high-touch surfaces is, and I will elaborate more on these terms as we go forward. Yeah,
all right, okay. And then what are some of the common pitfalls or traps that businesses fall into when they are trying to do the right thing, but maybe aren't doing it as well as they possibly could?
Well, you heard me saying things like infection prevention, high-touch surfaces, and cleaning. So 3 different terms, and we are talking of 2 ends of a spectrum, 2 opposite ends. Cleaning to disinfection is a journey from one end to another. Most of the organizations, officers today, who are not introduced to professional cleaning are on the other end, cleaning. They're not disinfecting. Yeah. They wouldn't know what a high-touch surface is, what a disinfection actually means, and there is a world of difference between the two. And that's a major pitfall.
So does this mean that cleaning and disinfection procedures are the same in an office as to a manufacturing centre or a healthcare facility when it comes to making sure that those areas are free of harmful microorganisms?
Well, yes and no. The basics are the same, but the procedures change from different organization to, from organization to organization because, as I said, high touch surfaces. So you consider a hospital, for an example. For a hospital, who is walking into a hospital? A patient, people attending a patient, nurses, doctors. Consider an office, on the other hand. It's people who have been working from home all this while, now they want to go back to office. So normal people who are not exposed to pathogens or viruses. So the cleaning procedure in a hospital and in an office is completely different. High touch surface in a hospital where it could spread infection is a bed rail, patient's bed rail. Whereas in office is probably your scanning machine where you put your thumb and then you open the door with the hand. But it's difficult for a normal office cleaning staff to imagine all these things. They're not trained.
Okay. So you mentioned that the basics remain the same, but what remains consistent when we talk about protecting our facilities from the COVID-19 and so on?
It's the procedures and the training element that will uniquely change from facility to facility and will make the difference at the end of the day. So, just give you an example. We work with a lot of hotels, hospitals, and commercial facility management companies like yourself. And the way we train our customers, it's every month there is a training on how to use disinfectants, what are high touch surfaces, how to use different chemicals, where to use, where not to use. And all these things are gaining even more importance in post-COVID scenario. And that's what will matter in times to come.
And I think compliance is also really, really important around getting that successfully done. And more to the point, you mentioned before hand hygiene. What can we do to make sure that businesses really make the most of being consistent when it comes around hand hygiene and compliance?
See, there is something called transepidermal water loss. You can buy any alcohol disinfectant from the market, but you can apply it on your hands and then you will see that your skin is peeling off in a few days. What we do is we take care of all these factors. So hand hygiene is gaining, WHO says that's the most important thing you can do to prevent yourself from infection, apart from other practices as well. So hand hygiene has been and will remain a very critical factor for preventing these infections as far as.
So these types of standards that you're referring to, is there a standard which says these are the areas that you should be cleaning and the frequency and so on? And can you give maybe some examples of where that might apply in an office environment versus some other environment?
Absolutely. So versus cleaning what we have been used to and in the past, like just take an office setup example. What is cleaning in an office? Clean the floor, clean the dining table, clean the desks. Well, guess what? You missed all the surfaces that carry COVID, actually.
Wow.
Okay. So high-touch surfaces are actually door handles.
Okay.
And as I mentioned, the scanner, the thumb scanner for your entry into the office, the water dispenser where you actually take care. These are the surfaces.
The coffee machine.
Coffee machine.
Going into the toilets.
Exactly. And most of the time, day-to-day cleaning, we miss all this. And that's what we try to cover in our trainings and education to our customers.
So are these areas that you think businesses are missing, and not because they want to, it's because they don't really know? What can we do as an FM community to better make businesses aware of where things really matter?
Well, I think it's at this going forward from here, most of the professional organizations, if they really want their people to come back, which most of the companies do, should ask for a support of companies like you, because just simply for the fact that you have people who are trained, who understand all these things, who will not miss out.
Yeah.
I mean, I could hire somebody from outside and just pay the same amount of money as I would pay you, or maybe a little bit less, but then end up not actually disinfecting my office and exposing my people. And the opportunity cost there is huge.
Yeah.
Right?
And look, when we talk about the workplace experience where employees have now been working from home or working from anywhere, yes, some are starting to return to the office, but we know that it's certainly not going to be the same moving forward. As we've mentioned on some of our other thought leadership series, there's going to be a hybrid working model where they're working part-time in the office and maybe a few days a week at home or somewhere else. We know that the employees will have a voice now. They will want to return to an office only when they feel that it's safe to do so. So I think what you're saying is really important in terms of giving the employers and employees confidence that using the right chemicals, using the right procedures, using the right organisations to do it correctly, then the world can get back to perhaps some level of normalcy.
Absolutely. That's the only way out. It's getting people back is only possible when they really feel they are safe.
Yeah.
That the outside their office or any other organization where they work is safer than their own office.
Yeah.
That's the only way. And to ensure it's safe, organizations will have to learn to adapt.
Yeah. Now, Vikas, the big question, the elephant in the room, right? Let's just face it. Everything that we've been talking about sounds great. It's required. We have to be clear about what we do, what frequency, how we do it, using the right chemicals. But then it comes down to cost. And we know that cost is a real big decision maker for any organisation, even when it comes to something as important as combating COVID. So, what's your message around perhaps using a product that is known to do the right, give the right outcome versus perhaps some more, I'll call it local chemicals that may or may not do as well as a good a job?
Well, the answer is slightly longish, but
okay.
I think it makes sense to say what I'm going to. Let me throw some facts at you.
Mm-hmm.
You yourself and people around you, when do you remember the last time anybody had caught cold?
Yeah.
Over the last 12 months.
Yeah, exactly. Yeah.
Cold has vanished.
Yeah.
And I was in one such conversation with one of my friends who is in medical insurance industry, and there's a very interesting fact. Now let's come to Thailand. The landscape of medical insurance in Thailand is completely different from the rest of Southeast Asia. And I'll tell you how. Your medical insurance in Thailand looks like something like number of visits, 25 visits.
Yeah.
And you ever imagine why? Because every time people catch cold, they want to visit.
Yeah.
So they do
it's
not
the default
care.
position, isn't it?
It's
Go to the hospital.
Exactly.
Yeah.
Now, that's the sensitivity of people around common cold. Look at the amount of opportunities or the absenteeism that it leads to. Just common cold. And now we are tackling with COVID. So if COVID is keeping people at home, and our job is to get them back to office. Now, with that small cost difference, which we had, it just vanished. It will pay for itself 10 times over.
Yeah, it's the cost of not doing it right, isn't it? Yeah.
So that's that's the simple economics of the whole thing.
Okay, thank you. It's something for all of us to consider. Look at the total cost and not just the immediate direct cost. So we love on this program to talk about our crystal ball. Now, and obviously, our crystal balls can't really predict the future, but based on your knowledge and experience, which is incredible within this this space, what do you think, if we were to fast forward to 5 years or 10 years, what do you think the workplace is going to look like, and perhaps how will businesses perhaps be changing compared to what they do today into the future?
Well, I was Singapore a few days back. Singapore announced that they are going to deal with COVID just like any other flu. So they're going to open everything up.
Yeah.
And I think that's the way to go. Yes, vaccinations, of course. And so what I see in future is people, of course, balancing between work from home and office, but you cannot beat the office setup. Productivity goes down when you're working from home. Right? So people in office with a professional cleaning company cleaning all the high-touch surfaces, keeping everybody safe. People have no concern visiting office and working from office. Yeah. Sanitizing every time they touch a high-touch surface or they visit outside, masking up. So that's the kind of scenario that I personally imagine.
That's the way that the future's going to look. Okay, same, but a little bit different. All right. So last question from me, Vikas. If a business would like to contact Diversity to understand more about how they can combat COVID, how do they do that?
Well, they can visit our website, or they can call our Thailand offices.
And with the website www.diversity.com. That's that simple. Okay, great. So that brings us to the end of this facility management thought leadership session with the spotlight on combating COVID. If you'd like to learn more about how PCS can support your business in terms of setting up for the future around disinfecting, cleaning and sanitisation, feel free to contact us at www.pcs.co.th, or you can also email us at customer@pcs.co.th. Thank you once again. I'm James Jessup. Stay safe and goodbye.